Hi there, and welcome to another Live Safe Tool video. This video is the first in a three-part series that together comprise the Introduction to LiST set of videos. So this particular video will be focusing on the background and the history behind the Live Safe tool. LiST is a multi-cause model of mortality. By that we mean in LiST, using LiST, you can model different cause-specific mortalities together, and you can also look at the impact of multiple types of interventions on multiple types of mortality as well, multiple cause-specific mortalities. In order to do that, LiST uses a number of different inputs. So it will need the baseline description of the health status in a country, so that's maternal and child health, to get an idea of what basically the baseline health status was for all of those people prior to any changes in intervention coverage. It will also need the effectiveness of the interventions, so how good those interventions are at preventing disease, or rather of preventing mortality, depending on the intervention. And finally, it will need the changes in coverage of proven maternal, newborn, and child health interventions. So that implies that there will be some changes in that coverage, which we can model with the tool. And what it produces as outputs, or the impacts that we can look at, is, of course, as you can guess from the name, lives saved. We can also look at the number of deaths, and we can also look at the mortality rates. And the objective of LiST essentially is to estimate the number of lives saved that could happen if we introduced a brand new intervention, or if we scaled up an existing maternal, newborn, or child health intervention that's already in place in country. And the goal behind doing this is to promote evidence-based decision-making. So with this evidence-based estimate that you can get from LiST, you can use that as a basis to create plans, modify plans for different projects or country-level strategies. It can also help with choosing which maternal, newborn, child health intervention to prioritize, because as we know, oftentimes we have to make some decisions, and this provides an evidence-based basis to make those decisions. So a little bit of background and history. LiST is funded by the Bill and Melinda Gates Foundation. And it started off initially back in 2003 as a tool to estimate the impact of scaling up only community-based interventions and only looking at child survival. And shortly thereafter, we added in facility-based interventions as well as neonatal mortality as an outcome. We also introduced risk factors, since not all interventions have a direct impact on mortality. Some of them first initially have an impact on risk factors, and those risk factors in turn have an impact on the mortality. It was then incorporated into Spectrum and became available in the public domain. It is still available today in the public domain. It is free and to be accessed by all. We added some additional outcomes, such as the birth outcomes, namely small for gestational age, preterm, all the low birth weight outcomes, as well as stillbirths. This is also when we added maternal mortality as an outcome, and we included pneumonia, diarrhea, and meningitis morbidity in the model as well. We then added the option to do some subnational level modeling, because many programs or projects are really programmed to be in a specific subnational area of a country. And we also developed the capacity to get sensitivity and uncertainty around certain outputs. And we also created a costing module that allows to put a financial tag on the cost of increasing or scaling up different interventions. Finally, this last part is forward thinking. So these are the things that the team is working on now at the end of 2018. We're aiming to get adolescent mortality as an outcome, as well as to include utilization and service availability and or quality of interventions to improve the estimates that we can get inside of LiST. LiST is generally used for one of three reasons, broadly grouped together. The first is perspective analysis. So for strategic planning at the beginning of a project, or even better, prior to the beginning of a project, LiST is a great tool to really decide where you want to focus your project, where you can have the highest impact, through which interventions to focus on, etc. Once again, LiST is evidence-based, so it provides a sturdy foundation on which to justify why you want to focus on the interventions that you choose. It can also be used for retrospective analysis, so it can be used to evaluate project or program impact with coverage measurements before and after a project. We can model the changes in mortality that occurred over the course of the project. It can also be used to attribute lives saved to different interventions. As we know, in many countries, many different interventions are happening simultaneously, and teasing out which intervention had the most impact on mortality can be a little bit tricky. So LiST can help with doing that type of retrospective analysis. Finally, LiST is a great tool for advocacy. Back to the fact that it's evidence-based, it gives a good rationale for advocating for specific interventions or specific fields, why this is the most urgent or the most pressing, or where there's the most potential to have the highest impact. We can have those numbers, have those estimates, and use that as an advocacy tool. And finally, to take a look at where LiST has already been used. So LiST has been around for over 10 years, and this is just a sample. This list is not exhaustive, but most of the people who have used LiST kind of are grouped together here. We have a number of international donors. Some international organizations have used LiST. Different NGOs have used it mostly for either project planning or retrospective analyses. Academic institutions, including our own Johns Hopkins Bloomberg School of Public Health, which is where the LiST team is housed, but some other academic institutions as well. Different country governments, once again, this is not exhaustive, but many have used LiST to help in their national strategic planning. And finally, different development and aid agencies have also used LiST to evaluate the impact of the projects that they're funding.